I just finished 4 night shifts working as a doctor in A&E, and it was shocking to see how many patients were waiting over 12 hours to see a doctor. A statistic that I think would shock a lot of people is that last year 5,000 fully qualified doctors applied to be emergency medicine specialists, but only 350 posts were given out in the whole of England. And this bottleneck guarantees a future shortfall of consultants that we so desperately need to deliver specialised care. And yes, the government did offer 1,000 extra specialty training posts this year, but given that 20,000 doctors are applying, it really is a drop in the ocean. So who are the resident and junior doctors that are striking? Well, it's anyone that isn't a consultant, which includes doctors that can independently carry out surgeries, that run clinics, and even doctors like me who, when I was only a few months out of med school, was covering over 60 patients, having end-of-life discussions and often being the first to see a deteriorating or unwell patient. We're definitely junior in terms of pay, but we're not junior in terms of responsibility. Doctors working today are getting paid 20% less in real terms than what a doctor working in the NHS was getting paid in 2008. Not only that, but doctors in 2008 were not leaving med school with over £80,000 worth of debt. And yes, this does take into account the NHS bursary that we receive. Not only that, but the demands of the job today are much greater than they were before. It was practically unheard of to have a patient waiting in A&E more than 4 hours in 2008. Also, a lot of people don't realise that every year we are forced to pay hundreds of pounds to the GMC for indemnity insurance, for college memberships and mandatory exams. So don't forget that the real disruption isn't our strikes, and we are not the reasons that the NHS is crumbling. In fact, as doctors, we are fighting to save it. What is to blame is the decades of poor political choices that have funneled money away from our schools, away from our NHS, and away from the public and into the top 1%. So please support the resident doctor strikes and not the smear campaign being carried out by the media and the government.